few weeks in regards to the material that we're covering. Okay, so the type of methodology that we're going to start discussing is uh, the foundation of everything, right? For measures of clinical association, specificity, sensitivity, likelihood ratios, okay, positive and negative predictive values, so on and so forth, is a type of methodology that we call Bayesian methods. Okay, the reason why this is really, really, really important for you to have some level of knowledge about, particularly within healthcare, right? Nursing, athletic training, OT, PT, whatever it is that you're doing, is because you need to be able to have a conception, right, of how accurate and how good are the tools that you use diagnostically every day in clinical practice, right? Um, and we'll give examples early next week about the use of potentially, certain blood biomarkers for potentially infection or other things, and how those compare to a gold standard, right? So this entire approach, right, and this entire way of looking at the evidence, right, is based on Bayesian methods. Okay, so as we just kind of already alluded to, okay, Bayesian methods are used to solve for the likelihood of events, okay, based on changing information, all right, on environments and on beliefs, right? So um, Bayesian methods is very much a different type of analysis from what we're used to as far as our frequentist approach, and we'll talk about the differences here more in a minute, right? But the Bayesian model is constantly updating probabilities and likelihoods based on changing information, right? So this was actually created by Sir Thomas Bayes, who was a theologian actually and a mathematician. And believe it or not, as you can see in the picture here, he was actually not 1,060 years old. Yeah, he was actually maybe only 6 years old. I should say 1701 to 1761. He was not Gandalf the Grey, right? He essentially he got into a bit of an ideological throwdown with a guy called David Hume, right? On unreliability. So David Hume was another philosopher of the time, right? Who was attempting to refute miracles, and Bayes, as a theologian, devised, right, his Bayesian approach to probability to actually originally refute David Hume, right? So ultimately, okay, probability is a branch of statistics that calculates likelihood of occurrence of a phenomenon based on chance. Okay, and that is a central question that we're going to be asking over the coming next couple of weeks, the next few weeks, is how likely is basically X, or how likely is Y given X, right? So an example that we will end up using is we take a little bit of information from orthopedics, right? Is so someone has a positive Lockman, right, which is a test we use to evaluate the integrity of the ACL in the knee, right? So if somebody has a positive Lockman, what is the likelihood that that person actually has an ACL rupture, right, in the knee? Okay, so that's essentially the model of the type of question that we're going to be kind of addressing and looking at over the next couple of weeks, right? But when we talk about statistics and when we talk about research methodology, there are two main schools of thought, right, regarding probability. So there's the frequentist approach and the Bayesian approach. The frequentist approach essentially looks at probability in hard terms, right, where we know about what a probability could be based off of a prior assumption. So the easiest example to give, right, to illustrate this phenomenon, right, is a coin flip, right? So we know that obviously if we have a quarter and we have one side is heads, one side is tails, we know that based on the likely probability that with one coin flip we are going to have a 50% chance of heads versus a 50% chance of tails. Okay, so let's say though, for example, that we essentially have 4 coin flips in a row, right? And we have, three out of the 4 land on heads. So then we have a 75% occurrence, right, of heads versus tails. So the Bayesian approach actually constantly updates the likelihood, right, of heads versus tails based on occurrences over time, right? And they continually update the likelihood of one outcome versus another, right? And I'll show you another example of that in a second. Sorry. Um, so ultimately, the the Bayesian approach will generally have a prior likelihood, right, that it will begin with, and it will be constantly updating its assumptions or approaches, and then result in a posterior probability, right? Um, so prior assumptions too, right, can also change, okay, based on given information, and they're typically updated using a Bayesian factor. We're not going to get into that in great detail, but let me give you an example, okay? Let's say that you are maybe in a clinical, or you're working, right, and you're seeing a patient. Um, what is one part of the clinical exam, right, that you think will give you a good idea of what's going on with the patient? What do you think? What's one part of your clinical exam that's going to give you that first possible probability for a diagnosis? What do you think?
I feel like vital signs are always really a good place to start.
Okay, vitals. Yep, that's great. Okay, what else? Good job, Emily. Thank you.
Maybe even like finding abnormalities in like head to toe assessments.
Let's go. Yep, fantastic. Okay, I love where you're going. Okay, now before we even get there, what's the question that we ask the patient before we even do any of that?
Maybe even like what brought you in today.
Yeah, your history, 1000%. Why are you here? Okay, tell me about what brought you in today. Yep. So ultimately, right, if we've done a thorough enough job and we've listened to the patient, okay, depending on obviously the level of training and experience, we're already going to have a prior probability or an assumption about what could be wrong. So we will have already developed, right, it, in our minds, the possibility of a diagnosis, or the percentage or the likelihood of a diagnosis based on information even from the history. And then, as Addie has said, and as Emily has said, right, as we're doing our head to toe assessment, right, and as we're doing also our vitals, right, we then obviously can further adjust the probability of that condition based on the information that we find. Yeah, wonderful job. Okay, great stuff. All right. So here's the deal. Okay. This is this is a graphic representation. Okay. And once again, like I said, we're not going to get into the weeds on this. But you can see here, this is an example on the left of a frequentist approach where, right, where the normal distribution, where the midpoint of this curve is right at 50% for that coin flip, right? Whereas on the right, as we look at the probability of occurrence of heads versus tails, okay, let's say that we have 17 coin flips and only 5 of those are heads. Okay, we're going to move the probability, okay, of heads versus tails, obviously back, right, to more like 30%, right? So you can see how the probability or the likelihood of occurrence is constantly changing in a Bayesian approach uh, based on uh, obviously number of occurrences. Okay, and we're gonna make this, right, a lot more relevant to you guys on Monday, because what we're gonna do is we're gonna go through, right, the possibilities when you do a diagnostic test, right. We have 4 possible outcomes that can possibly happen. Okay, we can have a true positive, a true negative, excuse me, a false positive, true positive, true negative, right? Um, a false negative, okay, or a false positive. Okay, so we have those 4 possible outcomes, and we can actually talk about what those mean, right? But though, but those the rate of those occurrences is what is going to lead us in the direction, right, of updating our probability and lead us to measurements such as specificity, sensitivity, positive and negative likelihood ratios, and positive and negative predictive values, so on and so forth. Okay. All right. And so obviously here we go again, right? You can see with total coin flips that we are constantly and continually updating assumptions, right, based on occurrence of heads and tails, okay, so on and so forth, right, and on and on. All right, here's an example, okay, here's an example of what we're talking about, all right? And like I said, we're going to dive into this deeper on Monday. Okay, so Bayesian factors express the likelihood of one ratio to another. Okay, so in healthcare, we're going to hear terms used to describe diagnostic accuracy, like we talked about just a second ago, specificity, sensitivity, likelihood ratio, and positive and negative predictive values. Okay, so question for all of you. All right, how many of you have heard of these terms, and what do you think, if you have, what do you think they mean? If you've heard of them. If you haven't heard of them, just say we haven't heard of that. Right? Okay, I take that as a possible no, that we have not heard of these terms. Okay, so here's an example, all right? So specificity, this is actually the ability of a diagnostic measure and or diagnostic test to detect a negative result when the disease is absent. So to truly be negative in someone who is healthy and does not have the disease or condition of interest, okay? So obviously we can see here, okay, if we have obviously a rate of, true negatives in someone who is truly healthy, right? We would essentially have a sensitivity here of 90%. And we are actually going to get into the math of how to actually calculate this on Monday. So we'll actually go through some examples together. Okay. Okay, here's the deal. Okay, this is super duper important. Sorry. Okay, and we're actually almost finished. This is a super short day today because I have some things I want to chat with you guys about when we're done. So let's talk about this as far as the magic of the number one. So there's a concept, guys, and we kind of utilize the term diagnostic math. Okay, there is the number one, right? And I'm sure all of you know that a ratio of one essentially is considered essentially a whole number and or perfect, right? And or a percentage expressed as one is 100%, right? So diagnostically, right? One, not I, that might look like the letter I, but it's the number one. Okay. Also, also represents obviously a perfect or presumably correct, right? Pretest probability. Okay, that the test is going to be true or accurate. Okay. Is there anything that you guys can think of that we utilize within clinical practice that is perfect 100% of the time without fail in making a diagnosis correctly? Yeah, I mean, so the obvious answer is no, right? There is no test and or measurement, right, that is diagnostically accurate and or perfect 100% of the time, right? So ultimately, right, with a lot of our expression of diagnostic accuracy, okay, we're operating under the assumption that there can only be one thing that's perfect all the time, and that is the gold standard. Okay, so we give the example when talking about ACL injury, because we use that example in the next lecture, right? Is the gold standard being arthroscopic examination of the knee under anesthesia, right? We actually go inside of the knee, right, and we look around and we make sure everything is healthy and intact, right? So that we can be 100% certain that that's going to be diagnostically accurate, right, all the time. But an MRI and or an exam maneuver, right, is not going to have the same level of accuracy, okay, that obviously a diagnostic arthroscopy is going to have, right? So obviously, you're a lot of your prior assumptions, right, are going to, be described generally as a static value, like a frequentist value, okay, based on maybe what you've read in the literature, based on maybe prevalence or incidence of a certain condition, right? Or you might be able to also express that as a Bayesian value, right? Or as a probability based on maybe the history and or known factors, right? Maybe you've been able to go in and look at a patient's chart, and you know that potentially they've had a metabolic panel that has occurred in the past, or that they've had done in the past, that has shown maybe they've had high glucose, and or maybe they've had maybe a hemoglobin A1C that has been indicative of prediabetes, right? So you know that there is obviously an increased likelihood of diabetes in this patient potentially over time. So, and as we've already kind of alluded to, obviously in medicine and healthcare, generally these prior assumptions, right, are generally kind of conceptualized as incidence and prevalence, or also a pretest probability, right? So yeah, and in the example that we give, obviously here as an example, is a patient that presents with fever and a sore throat, having a 60% probability of strep, right, prior to actually conducting a strep test on that patient in clinic. Okay. So guys, I know that this was a really brief overview, but we're going to actually apply this and lay it out in a little bit more detail, and I think a lot of this is going to start to make sense. Any questions on this super short, brief lecture? Anything at all? Okay, great. So guys, a couple things. I have this afternoon, I've gotten emails from some of you, and I've seen them come in, and I'm going to get to getting, some of you guys have sent me drafts of your method section to peek at, and I will get that. I will try to do, sorry, words are hard. I will do my very best to get that done for you this afternoon, so you have that feedback back. But please know, if you still need to send me your method section to look at while you have your computer up in front of you, please do that now, because I will not be available to look at or make any feedback to your method section after like 4:30 today, right? I'm going to be, I have family and religious commitments starting at 4:30 p.m. today. I do every week, but so I will not be able to respond to emails until Sunday or Monday. So if you want me to take a peek at it, please send that to me now so that I can take a gander at that ASAP. So yeah, you guys, I got to tell you something. I'm so glad that all of you are here. I know that you guys probably saw my email on, I guess that was Wednesday. And the one thing that I want to reiterate to you guys, okay? You guys have no idea how much I enjoy teaching this class, right? I genuinely like you guys a lot, right? You are, all of you you're doing great work, and you have been very, very involved in this class, particularly in subject matter that can be a little dry and boring, quite frankly. You guys have done well. So like I said, I want my time with you guys to be purposeful and impactful, and I want you to get a lot out of the class. So when I don't have you guys, obviously, in class, it's difficult to make sure that we are making progress and that you're learning what you need to learn. Okay. So I hope that all of you have a great weekend. Okay. And we will we'll see you Monday. Okay. If you guys have questions, just let me know. Okay.
Thank you.
Welcome.
Thank you.
Take care.
Thank you.
Yep.
Thank you.
Yep.